Hello everyone. We are group 3 and we're going to report about measles. So the topics that we are going to discuss is first the definition, causes, different types of measles, diagnosis, risk factors, signs and symptoms, treatment of measles, and then caregiver intervention.
Hi, I'm July. We are going to report measles. Measles, this is an infection, viral disease that causes fever and a red rash on the skin, typically occurring in childhood. When an infection person breathe, cough, or sneeze spread quickly, it may result in fatal complication, serious illness, or both. Although anyone can get the measles, kids are most frequently affected. Measles symptoms typically appear 10 to 14 days after the virus has been exposed. Symptoms that is most obvious is a noticeable rash. Initial symptoms typically last 4 to 7 days.
Measles is a highly contagious illness and it can easily spread to others. It is caused by a virus found in the nose and the throat and would easily spread throughout by an infected child or adult. Measles usually appear 4 days before or after the rash appears, and the risk factors are being unvaccinated, traveling, and vitamin A deficiency. So to avoid spreading the virus of measles, avoid kissing the child or touching or coughing or sneezing near the child. And that's it for causes of measles.
Risk. The two major lifestyle risk factors for contracting measles are choosing not to get vaccinated. As far as I'm aware, unvaccinated, you're much more likely to contract the disease if you haven't received the measles vaccine.
I'm here to explain regarding the symptoms or signs if that toddler or that child have a measles. So, yes, first ma-observe na nato sa sa bata na luya jud kayo kay nahilan na fever. Second is na siya yung mga red spot, mga pantal-pantal na puwa sa iyang skin. So, again no, since naman siya fever, magluya siya, murag tiredness na niya, mo na yatong ma-observe sa bata. And then ang young ubo, she or he or that child already have a barky cough. So, gahi jud kayo yung ubo no, paghut jud kayo yung ubo. And then, ang kanang bata na asa na siya or that child that we care na sa running nose. And then again, as what I said, it has a red rash which start at the head then spread downward. So makita na to siya una sa head, sa anit sa bata or sa agdang sa bata, paubos na dyan na siya hantod sa iyang tiil. Kung asa dapit ma-feel na to na asa dapit ang init sa ilog, dyan at area, sa kanang ko sa ulo sa bata, dira man dyan na dapit na init no atong lawas. So dira na unang magpantal-pantal or magkanaang bata na red spot or red rash ba, mga puwa-puwa na spot sa skin. So, as what I read regarding for that topics, which is a toddler measles, so we can say that it has a sign and symptoms. This is my explanation for that one. Measles infect the respiratory tract and it spreads throughout the body. Katong gingon na mag-una dyan siya sa ulo, kadong downwards. Then include a high fever, cough, running nose, and rash all over the body. Being vaccinated is the best way to prevent getting sick with measles or spreading it to other people. Muna importante kaayo na ang bata adyo na monthly visit jud na ano dyan nito, ipa-check up para sa for their schedule sa vaccine nila. So, it says that it is a initial measles infection. So, magmanifest na siya, no? Katong ubo, sipon, mag-red ang eyes, then taas ang hilana. Hi, good day. I'm here to tackle or explain regarding for different measles. So about this one, we have two kind of measles, which is a red measles and the German measles. About the different for this measles says yes. When we say it is a red measles, it's typically start as a flat red spot. So bagbuwag na siya na red spot. So, makita na nato siya first at the hairline of the face. And then, mudaw na siya, spread na siya sa atong neck, trunk, arms, legs, and feet, or over the flat red spot. There may also be a few tiny raised bump. While, ang German measles sad, matawag na nato siya German measles na siya, or rubella. That's the alternative word for German measles. Again, rubella is spread by direct contact with nasal. So, sa pusod or sa throat secretions of infected individuals. So, rubella can also, or German measles can also be transmitted by breathing in droplets that are sprayed into the air when infected person sneeze, coughs, or talks. So, viruses siya, kaya bisag makuha na to siya if that person that we encounter, that we talk, na siya measles. Dali ra siya dali ra ta matakdan na or makatakod siya. Regarding for the red measles, pwede rin na to siya home remedy na na kanang pagtambal, like if that person or that toddler na atong gi-care is na siya diagnosed regarding for the measles, then about the laboratory if that's measles is red measles or rubella, dira na to may balano da makaya ra na to if red measles, makaya ra na to sa balay asikasuhon na tong pasyente, painom ng tubig, katong akong gitakol regarding for the diagnosis. And then, regarding for the German measles or rubella, need na to dalon ang atong pasyente, atong bata, atong toddler sa doctor. Kay of course, need na nilang doctor kung unsay best medicine na ipa-intake sa pasyente. Hi, good day. I'm here to tackle regarding for a toddler diagnosis measles. So, yes, how can we say if that child or that toddler or our patient is diagnosed by measles? So, it says here that a doctor will suspect that that patient or that child or that person have a measles based on common symptoms including the fever and rushed, and especially if the patient has recently traveled internationally or was exposed to someone with have fever, would have measles, would have cough, would have a skin rash. It says that in 19th century, there's a Persian doctor who published the first written accounts of measles disease. So that Scottish physician demonstrated in the year 1757 that the measles is caused by an infection agent in the blood of patient. So regarding for this one, we can see if that person that we encountered that if na siya measles, makasulti rataan na, or kanyang tawahan na is na siya, or ang na-encounter na to or na-encounter sa bata, if na siya high fever, na siya mga skin rash, as what I said earlier, as what I explained that one. So, para may balaan na to ang atong pasyente, if unsa klase na measles na niya or measles ba dyan na ang niya. So, it says here that it needs to undergo laboratory blood and tissue tests. Iswab sa siya from sa iyang nose o sa iyang throat. So, dila na ito may ma-confirm na na-diagnose na siya sa measles o kung sa klase na measles ang naan ng bata, anang pasyentiha. So, makita rin na siya na to within 3 to 5 days after sa symptoms, no? Na nagsugod na ang measles niya. Hi, good day. I'm here to explain regarding the treatment and management of measles. So, unsa man ang iyang mga treatment ug angay buhaton, mga remedy if ang atong pasyente na ay measles. It says here that the virus must run its course, what usually takes about 10 to 14 days. However, based on what I read, ang giingon diri na wala dyan na siya specific treatment. However, we can do the treatment if ang kanyang pasyentihan na dyan ay symptoms sa measles na mawara daw na siya or so what I said, there's no specific treatment for measles and symptoms usually go away within 7 to 10 days. If there are no complication, if di ka siya komplikado, the doctor will recommend rest and drink a plenty of fluids or water to prevent dehydration. If there is a rest or komplikado na siya, the doctor may recommend to spending in the hospital kay naman na ipa-intake na to, no? Or na ay ipa-intake sa bata, sa pasyente na itong gibantayan as we are healthcare or child caregiver. So, based of my knowledge, that measles is, diba, virus siya, bacteria, virus. Has to run, it occurs a child who is sick should drink plenty liquid or plenty water. So, if ang atong pasyente na bata kay ma-diagnose na siya measles, so dapat as we are child care giver, ato dyan na silang painom ng tubig, lots of fluids. If baby pa, dapat ato lang dyan siyang ipa-breast milk lang sa mama or ipaano na to formula milk. Then atong papahuwayon, paslipo na to. Then dapat naro dyan na sa balay, dili na to sa school or di sa nato siya paduwa-duwa sa gawas or di sa nato igawas para mag-prevent na ma-spread ang mga infections or ma-prevent nato na makapatakod sa uban.
Caregiver intervention. As caregivers, we can provide supportive care by keeping the patient's nails short, encouraging long pants and sleeves to prevent scratching, keep skin moist with healthcare provider recommended lotions, help the patient avoid sunlight and heat, and by checking the vital signs to monitor the patient.